when we say infant mortality, how severe is this issue globally?
Thank you very much for that question. My name is Mary Zoyalo. I'm a registered nurse. So, infant mortality is a global public health issue. Especially in Nigeria, it's a very serious issue that we all need to really look into, both people who are in the healthcare sector and those who are not in the healthcare sector. You know, when we say something is a public health issue, it's something that concerns every one of us, just the same way COVID-19 concerns us. The number of children that die between age 0 to their 50th birthday, the number of children that die between age 0 to their 1-year birthday, and the number of neonates that died between the day they were born and 28 days is really, really alarming. And it's something we all need to put effort together to solve as a nation, as individuals, you know. And there are so many things we can actually do. There are so many positive change we can make in the healthcare industry that can help to reduce infant mortality in our society.
All right, Mary, glad to have you joining us on Early Exchange. It's been a while. Glad to see you again. Talk to us. Let's go to the root cause of the problem.
Thank you very much.
Now, let's go to the roots of the problem. You know, you have infant mortality rates in Africa to be very high, and a place like Nigeria. Talk to us. What are the factors contributing to these high rates of infant mortality in Africa? And let's look at Nigeria as well.
Okay, some of the major causes, some of the major factors that contribute to the high rate of infant mortality in Nigeria, in Africa. One major thing is the current economic situation, especially in Nigeria. You know, the current economic situation has made it so difficult for women, pregnant women in a country like ours. They can't, some of them can't afford proper healthcare service. The accessibility, healthcare accessibility is so low, they can't afford it. And because the healthcare system is also struggling right now, of course, a lot of sectors in Nigeria is currently struggling, which the healthcare sector is not an exception to. So women who live in the rural areas, even some women who live in the urban areas in the country, still have the problem of being able to access healthcare services easily. Because they can't, some of them can't afford it. In fact, most of them can't afford it. And for those who can even afford it, the question is, do we have enough hands to cater for the number of emergencies that we have? And that's talking about the personnel on ground. Remember that currently we have Japa syndrome going on in Nigeria, especially in the health sector for healthcare personnel, where most of the nurses we have all left the country. Doctors, a lot of doctors have also left the countries, and more are still living, and more are still going to leave. So if we now have very low number of healthcare personnel that are taking care of multitude of people, pregnant women especially, and the ratio of healthcare personnel to patients is really not equal, it's really not corresponding. So because of that, you would definitely have more children die, babies die between the day they are born to 28 days, which is the neonatal mortality, and then we have the infant mortality of between the day they are born to 1 year, and we have the child mortality between the day they are born to 5 years. Now, another factor is infection. You know, the environment, the kind of lifestyle and all that, infection, bacterial infections even STIs in pregnancy for women. Some pregnant women who have contracted sexually transmitted infection in pregnancy. Some women who were not able to prevent malaria in pregnancy. If you have malaria in pregnancy, it can affect the baby, the fetus, and which in turn can actually make us lose the baby at birth. So bacterial infections and some children infection, like infections that affect children at birth, like meningitis, that's the bacterial infection of the brain. The respiratory tract infections like pneumonia, bronchitis, and so many of them like that. And some are preventable, but some are something mothers cannot really help. So all these and many more are the factors that contribute to infant mortality. Now, before I stop, I would also like to talk about the lifestyle. It is so unfortunate that in Nigeria today we have more women consuming drugs and alcohol than we used to have. I can't really lay my hands on the statistics right now, and I don't want to say something that is now out of the book. So I wouldn't want to mention any number statistics, but I have read it and I have seen reports saying that we have more women, the female gender, now engage in drug and substance abuse and alcohol abuse more in Nigeria than it used to be in the past. So before we had more men, but now we have women. Now it is now worse off to say that even pregnant women in our society today still abuse drugs, substance abuse, take alcohol. So all this unhealthy lifestyle in pregnancy would definitely affect the baby. A pregnant woman who smokes, a pregnant woman who takes alcohol, a pregnant woman who takes marijuana and all sorts of things would definitely have the effect on the baby when the baby is born. And talking about other lifestyle, unhealthy lifestyle of pregnant women, it can also still boil down on the sanitation of the environment they live in because of the economic situation. Some of them live in the slum, some of them live in places that are not healthy for them. The sanitation would definitely bring in the unhygienic practices that would now in turn lead to infection that would affect the baby when the baby is born. And looking at it also from the angle of diet, a lot of these women cannot afford good meal, they cannot afford adequate diet, they cannot afford balanced diet in pregnancy. If malnutrition sets in for a pregnant woman who is not eating enough of protein, enough that would help her as a pregnant woman and the baby in utero. This would also affect the baby when the baby is born and live and meat. In those days, we used to hear that, oh, pregnant women should not eat snail. I've actually heard that before. People they will say, oh, pregnant woman should not eat snail because when the pregnant woman eats snails, the baby can start drooling saliva when the baby is born and all that. All these beliefs that are not really, that they are not confirmed, they are not researched, they are not true, but people just believe them. These are some cultural beliefs that people just follow and they tend to do it. And in the real sense, snail, for instance, is a good source of potassium and calcium, which is actually good for the baby when a pregnant woman eats it. Plantain, unripe plantain is a good source of potassium, which is good for the pregnant woman which is good for the baby when the pregnant woman eats it. So many other foods, okra, they will say pregnant woman should not eat okra, and it's a good source of vitamin. So all these beliefs and myths would prevent them from doing some certain things that would help them to actually take good care of themselves in pregnancy and the baby. And to crown it all, lack of education and empowerment, lack of information. Some of these pregnant women don't have the right people talking to them. They don't have the right information. They don't have the right education. Some of them are not very educated, but it is one thing to be educated because you've gone to school, you've gone through the four walls of an institution, but it is another thing for you not to be educated, but you still have the right persons who are giving you the right information at the time you need this information. So you can see that it is a whole lot of factors coming together. So it is either all the factors affecting one person, or most of the factors affecting one person, or one of the factors affecting one person. And I tell you, if a woman goes through or experiences some of these factors, it takes the grace of God for the child to survive at birth. If the child even survives at birth, it will take the grace of God for the child to live up to 1 year or 5 years of life, and which is infant mortality.
Okay, from what you said, yes, there are different factors that could result in infant mortality. And for some of them, they may be a resultant effect of the economic situation. But some, because of the lack of education, expose themselves to some of these things. So what are the pre-birth and post-birth practices that will prevent some of these situations from happening that would lead to the mortality of an infant?
Thank you very much. Pre-birth.
What are the things that she should
starting
do?
from the angle of pre-birth now, some women don't have the means and the capacity to be able to access prenatal care, that's antenatal care during the pregnancy. It is advised that from the moment you discover that you're pregnant, you go to a nearby hospital, healthcare facility, and you register so that you can start going there for treatment, for checkups, which we call antenatal care. And during the antenatal care, definitely when you go there, you meet nurses, you meet community health extension workers, maybe if it's a primary healthcare center close to you, and then you meet healthcare professionals who will be there to give health talks. I remember that when I was still in the clinical area myself, I used to do a lot of health talk. Even till now, I still do, because I am more in the community now doing public health awareness. And we conduct periodic health talk for women, pregnant women, when they come for antenatal clinic. In fact, the health talk session is one major aspect of the antenatal clinic that is never skipped. So the health talk is there that will help them. So when they listen to this health talk comes in different topics, talking about diet, the things they should eat in pregnancy, talking about the kind of lifestyle they should live, the hygiene, we even talk about breastfeeding, when they give birth, how should they breastfeed. In fact, it is even at antenatal clinic that we teach them, especially new mothers, that's mothers who are getting pregnant for the first time. We teach them how to hold the baby, how to position the baby to breastfeed, because some of them don't know, all these things and many more are the things they learn at antenatal clinic. But if they don't register for antenatal clinic and come to clinic, how will they be able to learn all this? The nurse will not come to your house to come and teach you. Especially now that we even have shortage of health workers, have easy access to antenatal care by registering at a nearby hospital, healthcare center for clinic. They will get all the information they need. That's one. Now, two, at antenatal clinics, we do periodic checks. They will do scan, ultrasound, to know the position of the baby, to know if the baby is well developed, to know if the baby is okay, what's the heart rate of the baby, and all that. Scan will help us to know. It is not just about the sex of the baby, because a lot of people believe that ultrasound scan in pregnancy is to know the sex of the baby, but in the real sense, knowing the sex of the baby is just one of the many things that ultrasound scan actually shows us. As regards the baby in utero. So we know everything that pertains to the baby, if the baby is well positioned, so that we will know the next thing to do. Now, also immunization vaccines that are supposed to be taken in pregnancy. For instance, the TT, the tetanus toxoid vaccine, and it is very, very important and compulsory in pregnancy. But a lot of women who don't have access to prenatal care would definitely not take these vaccines, which will pose a serious threat on the life of the baby when the baby is born. Because if the baby should have tetanus, even the mother can also have tetanus. The vaccine that has been taken in pregnancy would help to protect both the baby and the mother. And it is also during the prenatal care that we teach the mother the different immunization and the vaccines that the child is supposed to take at birth and at different intervals of the stage of life of the child. The one that the child will take at birth, like the BCG that is supposed to be taken at birth, like the polio vaccine that is supposed to be taken at different intervals, and so many of them like that. All these vaccines have stages, and they all have their advantages in helping to prevent illnesses, infections in the baby between 0 to 1 year age. So, and also, one of the things that also cause infant mortality is congenital anomaly. I don't know if I mentioned it earlier, but if I didn't, let me quickly talk about it. Congenital anomaly is a defect, so what we call birth defect in a child. When a child is born, the child has, maybe, let me give an example of cleft palate or cleft lips, and all that. If proper care is taken during pregnancy, it can actually prevent this also. And of course, it can even be diagnosed or seen in pregnancy already. And once we know the first the next things to do to help the baby survive, because a child who has cleft lips or cleft palate will definitely have a nutritional imbalance because the child cannot be able to feed well. So there are some things that will have to be done to help the child to feed well. So all these are prenatal care that needs to be taken in pregnancy to prevent infant mortality when the child is even born. During childbirth, labor, what happens? Because of lack of education, there are some pregnancy complications that occur maybe at the verge of labor that might require a woman to have a cesarean section, for instance. I have worked in a facility where the husband of the pregnant woman, that's the father of the child, refused vehemently cesarean section carried out on his wife, and because of that we lost the baby and we almost lost the mother, because we had a case of fetal distress and maternal distress. The child was already tired and the mother was tired too. That's and we lost the baby. Why? Because of lack of information, of knowing that cesarean section is actually not bad, but because of that belief that people carry that cesarean section is bad, oh, they can't do surgery, oh, surgery is bad, if you do surgery you will die, and all that. So it made the man just say, oh, I don't want my wife to, she's going to give birth like the Hebrew woman, and all that. Yes, you can give birth like the Hebrew woman, but if you don't have a normal delivery for some reason, for some health reasons, you can actually do a cesarean section to help you and the baby survive, which would actually go a long way to reduce the number of infant mortality or maternal mortality we will definitely have in that year. If your baby should survive, then your baby would be, So education is important, prenatal care is important, and even the postnatal care. Postnatal care is also important. Now, before I go to postnatal care, still talking about the labor, that's during childbirth. When I have seen women who actually register at the hospital for prenatal care, they attend antenatal clinic, they do scan, they have everything going on well for them during pregnancy, and lo and behold, on the day of labor, they don't go back to the hospital. They rather stay in the house and call a qualified or unqualified person around their neighborhood to come and take the delivery in the house. Or some of them will say they are going to church to have their child. because they want the Holy Spirit covering. I am not against that. This is not a religious argument or a religious talk, but I am saying that whatever makes a woman be able to afford antenatal care, antenatal clinic, why can't you go back to the hospital to have your child? So they make that mistake. They have antenatal care. Everything was going on well for them, but on the day of labor, they go somewhere else to have their child, and then they end up losing the child at birth. Or even though they don't lose the child at birth, something just happens that affects the child at birth, which will now make the child die before 1 year or even before 28 days, which is neonatal mortality. Now, coming back to the postnatal, if after you've had good care during your pregnancy and you've had good care during labor and you've had your child very well, everything is going on well already, between the 28 days of the childbirth to 1 year, there are so many things you can do to ensure that your baby survives, especially if there are some factors that are already against you. Maybe you had your child preterm. Preterm child is the fact that a pregnant woman had a baby before 40 weeks, the normal 40 weeks of gestation. Maybe the pregnant woman had a baby at about 20 something weeks, or maybe 30 weeks or thereabouts, So the child has not really taken time to develop very well in pregnancy before the baby was born. A lot of factors could actually cause it. Malaria in pregnancy can make a woman fall into labor at the time she's not supposed to fall into labor, early labor, and the child will have to come out. And hypertension in pregnancy, that's a preeclampsia, can also make us have to bring the baby out so that we can save the woman, because the more the pregnancy is developing, the more the blood pressure will be going up. So we want to save the child, we want to save the baby so that the woman will not throw a fit. We have to make the baby come out preterm. So a lot of factors can cause a child to be born preterm. So that is already a problem. If a child is born preterm, the child needs a very holistic care so that the child can develop, because the child will definitely have a low birth weight. The child will be so small, and the child will need some warmth to help the child grow so that the child can actually be able to go home safe, because we will not discharge a preterm child if we are not sure that the home environment to put the child maybe in an incubator or something. But if the woman did not access good care, good health care, how will all these things be done for such a child who was born preterm with low birth weight? Now, if your child is born with low birth weight, you take the child home. What are the things you should do postnatally to help the child survive it? Good nutrition is very, very important. Good nutrition, which starts from exclusive breastfeeding. But because of the economic situation right now, people, pregnant women don't only eat on healthy during pregnancy. Even after childbirth, they still don't eat healthy. So when they don't eat healthy, you are trying to do exclusive breastfeeding, and the child needs to get all the proper nutrients from that breast milk. You cannot give what you don't have. You don't have the proper nutrients in your body system. How will your breast milk have the proper nutrients to give a child? So you, as the mother, a new mother who just had a baby, you are malnourished, and your child will definitely be malnourished for so many reasons, So a woman who has just delivered postnatally has to eat well. And when I say eat well, take a lot of vitamins and protein. And I have noticed in my years of experience in the public health field, giving health talks and everything, I have noticed that people lack the knowledge. Not just the pregnant woman or the new moms, everybody, both men and women, adults and young. People lack the knowledge of food combination, because the kind of food we eat in Nigeria, we have more carbohydrate food than the rest. and it also looks like the carbohydrate food are more affordable and easily accessible for mothers, for people, so people tend to eat more carbohydrate, and they lack the knowledge of food combination, the best way to combine carbohydrates and protein with vitamins to make a balanced meal.